COVID-19 has changed a lot of what we do on a daily basis, and health insurance providers are working to keep pace. And we're learning about some of the changes this morning as we kick off a new partnership with Regents, BlueCross, BlueShield of Utah. This annual partnership was created with the goal of empowering and educating Utahns about various health topics to help them living their best lives as possible.
And this week, we are learning more about the issues and changes within the healthcare industry during COVID-19.
With us this morning is Jim Swayze, president of Regents, BlueCross, BlueShield of Utah. Oh, good to see you, Jim. Thanks for joining us.
Yes, good morning. Thank you for having me in a safe way. It's great to be here. I want to thank you guys for all that you're doing. I was working out this morning and saw your food drive that you're doing this morning as I was sweating. And what a great way to start this talk by saying Regents would like to donate an extra $1,000 to support your cause. So thank you for what you're doing, and it's great. We really appreciate it.
Well, that's fantastic. We certainly appreciate the donation, and as you know, Fox will match that. So that's wonderful. Let's talk about this new partnership that we've formed, and tell us what that's going to mean over the coming weeks.
Yeah, we're really excited about this partnership with Fox 13. I think we can do a lot of unique things together. Every week, we want to bring tips and information about healthier living. We also want to bring interesting insights on our community partners. You know, COVID is changing so much, and there's so much going on right now that we really want to keep a pulse on that. We also want to look at what we're doing collectively, like what you guys are doing and what we're doing to help our neighbors, you know, through these uncertain times. Some of the things we want to do is like showcase good works done by some of our clients. I can call a few out now, like Snowbird. They've done some wonderful things with their employees to support them. Mountain America Credit Union, OC Tanner, and Purple Mattresses, just to name a few. We also want to work with our employer groups to help keep people covered. You know, insurance coverage is a form of security. Utah leads the nation with 65% getting their insurance from their employer. So we want to work with employers on strategies to keep people covered where they can, but also on critical return to work strategies. Another topic, and again, this is broad, is it safe to go see my caregiver or my provider or the emergency room? A lot of people aren't going out of fear, you know, and that's a big issue that we have to work and talk about. And, you know, I just mentioned caregivers. I want to give a quick shout out and thank you to all the caregivers. I have two daughters that are nurses, and, you know, I thank them every day for what they're doing, and also all the frontline workers for what they're doing to keep things going. So that's a quick nutshell, but a lot of topics and a lot of fun things to do with this.
Yeah, I can't wait to dive into all of that in the coming weeks. You touched briefly on virtual healthcare, and I'm sure that is a pressing question for a lot of folks. How would you suggest folks get started on that, and how is that working out?
Yeah, you know, COVID has affected all of us. Virtual care is really one of the biggest areas. You know, I can throw out a power statistic which really punctuates that. In all of 2019, Regents had about 25,000 virtual visits. Again, telemedicine being a form of that. Through the first week in May of this year, so 2020, we've had over 230,000. So that just shows, you know, what I like to say to people is COVID hit the fast forward button for virtual visits and telemedicine. We've done some things as Regents to help our providers and make it easier and bring down some barriers so people can do that. You know, why do we do that? It makes sense. You know, if you can have an interaction like this, it's safer, it's secure, it helps slow the spread, all the things that we want to do. We also decided early on to pay for virtual visits at the same rate as a telemedicine visit, which is normally at a reduced rate, and we're doing that to help support our providers.
Oh, Jim Swayze, we are looking forward to this partnership, Healthier Together. And of course, we're looking for ideas and health questions, segments that you would like to see here. You can send your ideas to fox13now.com. And I think next week we're going to be talking to Dr. Amy Kahn, who will discuss the fear of going back to work and what that means for folks as they adjust to what we're always saying is the new normal, ever evolving. So, Jim, thanks so much.
Thank you.
Yeah, thank you for having me. Have a great day.
And thanks for that donation. That's awesome.